Welcome to Allegiant Stretch. My name is Tim. This is block 11. We're going to build upon this position of abducted hip, so a 90-90, working hip internal rotation. This week, we're going to work a little eccentric neural grooving. We're going to build in some transitional paths or iso movement paths, sometimes what they're called. And then we're going to progress from that 90-90 position to actually a bear position to start working shoulder, which we're going to predominantly focus on shoulder internal rotation. So a lot of hip internal rotation, a lot of shoulder internal rotation, as well as a lot of transitional movement. So we're going to open up with cars. Again, controlled articular rotations, working on neck all the way down to toe. Take you through step by step. We're going to do this for time instead of for reps. So you're thinking quality, not quantity. Get as many quality reps as you can in the quantity. All right, let's open up with neck. Find a good base position, feet hip width apart, nice, steady, strong position to move. Let's go ahead, bring that chin down towards your chest. Rotate towards your left shoulder, drop the ear, circle all the way around, bringing that ear to the opposite shoulder, rotate, bring it back to the start. We're going to continue in that direction for 30 seconds, and then I'll let you guys know when to switch. Thinking about making that circle as big as you can, 1 mile per hour, trying to rotate through as much of a range of motion as you can. If you feel any pain when you get to that closing angle or that small angle side, just simply go through a little less range of motion. Once you get to the start, reverse directions. Now we're going the opposite direction, just going 1 mile per hour, trying to make that circle as big as you can through each rotation as you can. You might find you have a little bit more range or a little bit more fluidity with movement, one way versus the other. That's normal. We are naturally asymmetrical, meaning we have a difference from left to right. This is why we put so much emphasis on unilateral movements within our program. When you finish this rep, go ahead, relax. We're going to move it down the spine. Give yourself a little bear hug. We're going to bring our chest down towards the ground. We're going to rotate towards your left, drop your left shoulder, circle all the way around. When you get to the start, keep going in that same direction, 1 mile per hour. Try to make that circle as big as you possibly can. Circle all the way around. Remember, if you feel a pain in that closing angle side, aka the small side, that means we have a little bit of an impingement going on. We just want to take a little bit of range of motion off. If you feel a lot of pain, you may need to stop entirely. But as we're going through this, try to explore as much space as you can. Finish the rep that you're currently on. Let's reverse direction. Going 1 mile per hour. Try to make that circle as big as you possibly can. Locking in that joint above, which would be your neck, and that joint below, which would be your hip. Only thing moving is your entire spinal column from your tailbone to the bottom of your neck. And finish the rep that you're currently on, and we'll come back to the start. Now we're going to go arms out in front, closed fist, because we want to isolate that scapula. Now we're going to retract our shoulder blades back, elevate your shoulder blades up, push your shoulder blades forward, bring your shoulder blades down. If this is backwards, we're going to keep going backwards for 30 seconds. So this one direction, retract, elevate, protract, depress, and keep circling forward. Imaginary shelf our hands are sitting on, so our hands can go forward and back, but we want to avoid them going up and down. Finish the rep that you're currently on, get back to the start, now we'll reverse. Protract, elevate, retract, depress. Now we're moving a forward circle. Again, hands forward and back, not up and down. 1 mile per hour here. Take your time. Try to make that circle as big as you can. You'll notice you'll get a little fatigued in that mid and upper back. This just means that we're moving through a little bit more of a range or more focus than we normally do, which is all natural. As we go through this, you might find a crampy sensation. That just means we're entering ranges that we're not accustomed to, and your body's trying to find a way to either accommodate that range or maybe possibly get out of it. These are now potential that we're adding into it. So the more comfort we get at that range, the better we're going to be at that range. We're going to move on to shoulder. Let's go left side, Point your thumb pointed straight out. The first move is going to be up, across. Keep that thumb pointed out as long as you can. When you get to that ear, start to rotate that bicep in. That thumb will come forward. Then reach that arm behind. We're going to keep that rotation going till we get to that pocket. Now that thumb should be pointed behind us. Reverse that direction. You'll feel a block. Then we start to unrotate or unravel and just retrace our steps. We're going to do this one for 60 seconds. So we're going to keep going back and forth from forward to back to forward for 60 seconds, trying to accrue as many quality reps as we possibly can. Remember, we're looking for quality, not quantity here. 1 mile per hour, lock that rib cage in, thinking about creating as much of a circle as you possibly can. Excellent work. Keep it going. And let's finish this rep that we're currently on, and then we'll flip to the other side. Now we're going to go right side, thumb pointed out, bring it all the way to your ear, bring that arm all the way back, reverse direction, 1 mile per hour here. Thinking about tick-tocking forward and back to forward. As you get to those like sticky parts, the top of the shoulder, that extended position of the shoulder, or when the arm's pointed back, create as much tension throughout your body is the concept called irradiation, meaning that we're trying to create tension or stability to access more range in a particular joint. This is a really important concept to start to establish during CARs, that concept of irradiation, to access more range and get more out of the actual exercise. Pails and rails, even breathing. The more we can focus on locking in certain joints, there's a concept called centration of locking in a joint to create more stability and more output. Same concept with the radiation. Create more stability throughout your body, create this almost Valsalva type of mechanism. Let's finish this rep that we're currently on. We're going to move on to elbow. So thumbs pointed out. We're going to flex at the elbow. Get all the way up to your bicep hitting your forearm. Rotate your thumbs inward. Come on back down. Reverse direction. We're going to just tick-tock back and forth. And this pronated to supinated, aka holding soup, dumping the soup, for 3 reps here, not necessarily for time. Awesome. Once you finish with 3 reps, we'll bring your hands up to 90, or elbows up to 90 degrees, palm in a supinated position. Close your fist. Let's bring your fist down towards the ground, and we're going to make a clockwise circle for 3 reps. And then a counterclockwise circle for 3 reps. We're going to move into hip. If you need something stable, like a wall or even a chair, by all means, please grab one. We're going to work on hip, and the more balance and stability we have, the more range we'll have. We're going to do the same thing we did on hip as we did shoulder. So whatever leg, inside arm's going to be holding. Let's bring that knee all the way up towards your chest, as high as you can. Rotate that shin inward. Pull that knee out wide, reach that heel behind, keeping your torso nice and tall, circulating back and forth for 60 reps. This one's going to bring more attention to creating stability. So as I bring that knee out and I rotate that heel behind, that torso is going to want to dump the opposite way. That's creating space. And you'll notice that position when we get into our flexibility work, aka pails and rails. And this is trying to create space that my hip doesn't have. So I'm going to dump my torso away to give myself the perception of having space in that joint, where I'm literally just trying to find a way to compensate in that direction. So fight that now. Create this active range of motion as you're going through that hip. So knee up, rotate, bring that heel behind you, keeping that torso nice and tall and rigid, almost stoic, and then bring it around. Finish the rep that you're currently on, and we'll flip to the other side. Bring that knee up, rotate, heel behind you. Awesome. We're going to tick-tock back and forth here for 60 seconds, keeping your torso rigid, stance leg strong. Use that inside hand to give you more stability. Irradiate is that term. Create tension through your body so we can get more from that targeted joint action. Knee up, knee out, rotate, pull that heel back in. We're just going to tick-tock back and forth, 60 seconds here, thinking about getting as many quality reps as you can. That sticky part, create tension. Again, these high volume sets, these elongated sets, 60 seconds, you'll feel some kind of tension, some sort of crampy sensation, fight through. Okay, now we're gonna go back down to knee. Same thing as elbow, we're gonna do this for reps. Knee and elbow are same joint, ankle and wrist are same joint, hip and shoulder are same joint. So we're gonna train them exact same from top to bottom. All right, so heel pulled in towards your hamstring, rotate your knee out. So now where heel is pointed in and that toe is pointed out. Extend the knee, pull that heel back in, rotate that shin pointed in, so heel's pointed out. Extend, back in. We're just gonna tick-tock back and forth here for 3 reps. Once you're done with 3 here, we'll lock out the leg. We're gonna lock out that knee because once we start to move that ankle, the more that knee is flexed, the more that shin can move or that tibia. That can alter the range of motion or perception, again, a compensation. So lock that knee out, create centration in that knee, point that toe towards your shin, heel in, toe in, make a circle clockwise for 3 reps. Feel all that tension and counterclockwise. Try to move through as full circle as possible. Perfect. Let's go to the other side. Pull that heel in, rotate that shin out. So toes pointed out, heels pointed in. Pull that heel back in, reverse. We're gonna go 3 each way there. And then we'll go ahead and lock that leg out. Make a clockwise to counterclockwise circle. Perfect. Now, we're going to go on to toe here. So in toe, feet are going to be hip width apart. Thinking about all 5 toes are in contact with the ground. You should be able to feel the ground. This is the biggest proprioceptive organ we probably have that we're not using, meaning that the more I can feel the ground, the more I can use all 5 of my toes, the better strength from the foot up I'll have. So let's go ahead and increase the range, increase the stability, increase the function of your feet by learning how to re-educate them by moving them. All right, so let's go ahead. 5 toes are in contact with the ground. Pick your big toe up as high as you can and hold. So big toe is now elevated, 4 little toes are staying. Place that big toe back down on the ground. Let's repeat that again. Big toe back up and back down. Let's do one more. Big toe up and back down. Now, big toe is going to stay on the ground. Now we're going to lift our 4 little toes up. So big toe down, 4 little up, back down. Big toe down, 4 little up, back down. Big toe down, 4 little up. Great. Now let's lift all 5 toes up off the ground. So now my 5 digits are away from the ground. My whole heel and base of my foot is on the ground. Touch your big toe down. Back up, down, back up, down, back up. Now what we're going to do is spread our toes as wide as we can. And we're going to try to touch from our pinky toe down to our big toe, 1 toe at a time, like we're piano keying down. So pinky toe first, second, third, fourth, and then big toe. All 5 toes back up. Second, third, fourth, fifth, big toe back down up. And then we're up again, spread, pinky down to big toe. Awesome. We got one more drill. Let's get into an all fours position. So our base position for quadruped, hands and knees. Not just hands and knees, but shoulders stacked over wrist, hips stacked over knees. From here, we're going to go through cat camel. Thinking one segment at a time. So pull your head up. So now I'm in cervical extension. Bring my chin down and then push my upper back towards the ceiling. Trying to pull each one of my vertebrae up, 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 and then you'll get to your tailbone. Tailbone will dump behind and down. Now from here, start at the tailbone, and then one segment at a time, bring each one of your vertebrae close to the ground, get towards your neck, and then elevate that neck again, and then we're just going to snake back down. And then back up. Back down. And back up. Awesome. Now we're going to go into a second position. So we're going to bring our hips back towards our heels. So I'm in this now collapsed position. And what this is doing is taking this lumbar out of the equation, right? So now my lumbar is completely locked in. So now what I've done is create that centrated effect or that locked joint effect. And now I'm going to have to get more range from somewhere else, which will come from the upper back, aka the thoracic spine. So we're just going to go through the same movement. Start off with extended, bring that chin down, so now I'm flexed. One segment at a time, pushing my vertebrae up and back. Go till you feel a block, and then reverse direction. And we're just going to snake up and down, almost like a slinky going down the stairs. One vertebrae moving at a time, trying to create a smooth, gradual transition up and down. We'll go one more rep. And then we'll transition forward. Then we're going to get down to our elbows. So now we're going to block our upper back, and now we're going to focus on our lumbar. So extended, flex, push as much of your vertebrae as you can towards the sky, and now we'll get down to that tailbone. Reverse, all the way back up. 3 up, 3 down. Awesome. Got it. That is our foot more than a 1/4 inch up off the ground. So if you can lift that foot pretty high, rotate, get upright a little bit more. If you're pretty stuck in this position, the option would be coming out of it just like this here, where I can move a little bit more freely. But the idea is to try to get upright, rotate towards the back leg, and then we're going to hold that stretch here for 2 minutes. We're going to open up with pails and rails. If you're new to stretch, PAIL stands for progressive angular isometric loading. Rail stands for regressive. So basically it's just a fancy word of PAILs is going into this stretch or going away from the stretch, and then rails is going closer to the stretch. Rails is more synonymous with this closing angle, so I'm trying to get hip internal rotation. So what I'm trying to do now is turn this leg, rotate it inward, which will pick that back foot and chin up off the ground. We're holding in this position for 2 minutes to set the stretch. The idea is to try to get comfortable here, try to relax your breath, breathe in through the nose, controlled exhale out through the mouth. That is the best way to control both autonomic systems, the parasympathetic and sympathetic. Exhale is going to be synonymous with this is parasympathetic, or this rest and digest. So when we get to this kind of end range positions, just remember, if you start to cramp, if you start to get really tense, control your breath, relax your breathing. You can use that in any circumstance. We're a minute to go. We're going to go PAILs by driving that from the knee down to the foot into the ground. So I'm going to ramp you up in terms of intensity. We'll go 20, 40, 60, 80, 100, so that every time I'm getting to an upward tick in intensity, I'm driving harder and harder into the ground. When I get to 100%, we'll hold that for 10 seconds. So you determine your safest, greatest effort. At the end of that 100%, 10-second hold, we'll trap the knee, lift the foot and chin away, trying to get into that regressive angle or create more of a closing angle and internal rotation of that back hip. The idea is to try to get to that end range and then capitalize on that newfound range by rotating harder into that position. So I'm now, once I find a little bit more space in that hip, I want to get more upright and I want to rotate more towards the back leg. Let's take a deep breath in, pack the air down, start to create pressure, and then start to drive from the knee down to the foot into the ground, 20% of your strength. 40%, 60%, 80%. Now you determine your safest, greatest effort. 100%. Hold this for 10, 9, 8, 7, 6, 5, 4, 3, 2. Trap the knee, lift the foot and shin as high as you can without rotating, shifting, or adjusting. 10, 9, 8, 7, 6, 5, 4, 3, 2, and parachute down, rotate more towards that back leg. We're gonna hold this end range here for another minute. Now we're gonna stay on this side and we're gonna work hip internal rotation, eccentric neural grooving. So what we're thinking about, remember that pails, we're driving the back foot into the ground. So we're gonna drive the back foot into the ground and then we're gonna rotate from a less passive end range into more of a passive end range. So the idea is I'm pulling myself actively to that passive end range. So whatever range I would have from terms of flexibility, I'm trying to get closer and closer to that while I'm still creating this pales contraction. This will feel an interesting sensation in the hip. Determine what your safest, greatest effort is and where you want to push in terms of pushing hard into that back leg into the ground, rotating hard towards the back leg there. The idea is to try to find this now new neural pathway that we can override whatever nervous system blocks going on in that hip that's limiting internal rotation of that hip. So let's move a little bit out of that position. So we're gonna set up now away. So from here, I wanna line my sternum up over this front leg. I'm gonna posture up, create closed fists. So imagine like you're punching something. Start to drive your back foot into the ground. And then we're gonna rotate back towards that back leg. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Reset. We're gonna do 5 reps there. So here we go. Arms out, over that front leg. Clench your fist, create tension, drive that back foot into the ground, rotating towards the back leg. 10, 9, 8, 7, 6, 5, 4, 3, 2, 2. Here we go. Pack. Drive that back foot down into the ground. 10, 9, 8, 7, 6, 5, 4, 3, 2, 3. 2 more. Pack. Back foot down. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 4. Pack. Drive down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 5. Sweet. So now we're going to work what we call a hip switch. So essentially I want to take from this 90-90 position to the opposite. So I'll be turned around here. Once I get to this other side, 90-90, I'm going to reorient. If you can see me, or if you're losing sight of the camera, just try to find that. A good kind of point of reference is, can I keep both glutes or butt cheeks in the same spot as I pivot? You'll notice a lot of folks will move forward. We'll have more internal, external rotation in one hip. So we'll start moving in that direction a little bit. Whatever the end position, it's just a good indicator of try to create more tension, try to push more glutes into the ground, and then try to disassociate my pelvis to my femur and move exclusively through my femur. So the idea is I'm going to rotate open to a bare position, and remember that position, over to the opposite leg, 90-90. We're going to use a kickstand if you need it. So meaning I'm just going to hold my hands on the ground, pivot around, or we can do exactly what we just did with our arms out in front with our legs rotating side to side. All right, so first rep will be on me. We're gonna do a 5 count going backwards. So find yourself a stable position. If you already know this one, you wanna go no hands, please do. We're gonna open up the back leg. So now I wanna get both butt cheeks on the ground as quickly as I can, create as much separation between my legs as much as I can, and then I'm gonna pivot the back knee towards the ground. So now I'm in the opposite 90-90. We're gonna now keep this front leg glued to the ground, Open my back leg as wide as we can, create as much separation between both knees as much as you can, and then get back to that start position. That would be 1. We're gonna do 5.5 reps here. So let's open back up again. 5, 4, 3, 2, 1. 5, 4, 3, 2, 2. 5, 4, 3, 2, 1. 5, 4, 3, 2, 3. 5, 4, 3, 2, 1. 5, 4, 3, 2, 4. 5, 4, 3, 2, 1. 5, 4, 3, 2, 5. One more half rep. 5, 4, 3, 2, and now we are on the opposite leg forward. So I'm just going to reorient so you can see me or I can see you. We're going to go 90-90 position. So if my left leg was forward, now my right leg is forward. All right, so now I'm going to posture up, rotate towards my back leg. I'm going to reset now facing this way. We're going to hold this here for 2 minutes. Hip internal rotation, eccentric neural grooving. We'll go from bear. We'll go from 90-90 hip switch to bear next, which I'll show you here in a second. Again, try to relax that position. Try to, as you're going through this multiple times, switch that front leg. So we're always focusing on a different leg each time. Just gives a little bit more, how should I say it, focus on one side versus the other, right? So if we're always doing right leg first, chances are that's probably when we're freshest and we're probably gonna get the most bang for our buck from there. So if we can try to figure out a way to balance out both sides, it'll make a huge difference over time, especially if you're doing this multiple times a week. 1 more minute here. Again, we're gonna go pails and rails, so driving from the knee down to the foot into the ground, ramping up to 100%, holding that for a minute or 10 seconds, and then we'll do it to rails, pulling that back leg up off the ground, holding that for 10 seconds, and then at the end, we'll sit deeper into that end range for a minute, work eccentric neural grooving. Halfway through. If you notice that as you're going through this stuff that you find that there's a pinching sensation or a kind of painful sensation, the biggest thing you can do is just either move yourself more out of that end range or create less tension. So if I'm driving really hard down into the foot or I'm pulling that leg really hard away, we might be getting to this end range and we might find some stuff, either there's a bony prominence or just some tissue built up over the years. It just takes time. If it's really painful, if everything hurts, you know, that's something that we really need to consider of stopping this altogether and doing something different entirely. All right, 15 seconds, we'll get pails and rails. Remember, pails is driving into the ground, rails is pulling the foot away from the ground, trapping the knee the entire time. All right, here we go. Let's take a deep breath in, pack the air down, start to drive from the knee down to the foot, 20% into the ground, 40%, 60%, 80%, you determine your safest, greatest effort, 100%, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Trap the knee, lift the foot and shin, 10, 9, 8, 7, 6, 5, 4, 3, 2, and relax. Turn more towards the back leg. If you can, we'll hold here for another minute and then we'll get set up here for eccentric neural grooving. You might find that you feel a little bit more crampy sensation on one side versus the other. This means either you don't have as much active range or foot mobility. That's why we're doing this. That crampy sensation just means that you're getting to that neurological end range and your nervous system creates tension to get you out of there. So we just got to create more range so we have more control and better overall function at that range. So we're going to go into that eccentric neural grooving. We'll line up over the front leg, rotate towards the back leg, 5, 10 counts, hip switch, and then we'll go to bear. Okay, let's move over this front leg, both arms in front, create tension in both hands, drive that back foot into the ground, rotate towards the back leg, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7, 6, 5, 4, 3, 2, 2. Pack 10, 9, 8, 7, 6, 5, 4, 3, 2, 3. Pack 10, 9, 8, 7, 6, 5, 4, 3, 2, 4. Pack 10, 9, 8, 7, 6, 5, 4, 3, 2, and 5. Sweet. Now we're going to go into our hip switches again. If you were in that position where you're using both hands and you want to go to either one hand or no hands, by all means, please do so. All right, remember, keeping both butt cheeks glued to the ground, moving exclusively through the hips. The harder it is, probably the more effective or the more you'll get out of it to an extent, right? So find that position where you could be successful, feeling the mobility achieved, and then let's see if we can get better and better incrementally over time. All right, here we go. So back legs moving up off the ground, rotating open, 5, 4, 3, 2, and 1. And we're going to reset, open, 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 2. 5, 4, 3, 2, 1. 5, 4, 3, 2, 3. 5, 4, 3, 2, 1. 5, 4, 3, 2, 4. 5, 4, 3, 2, 1. 5, 4, 3, 2, 5. We're going to do a quarter rep into bear. 5, 4, 3, 2, and now we're in bear. So bear is heels outside of our knees, knees pulled up towards our chest, chest pulled forward. You'll see a lot of people really struggle in this position. Just take a yoga block, sit on top of it, or some books to get yourself into a better position where you can hold. From here, we're going to work shoulder internal rotation. So we're going to take both arms, start off to the side just like such, rotate your thumbs straight ahead. We're going to bend our elbows and then reach both arms up behind our back and hold right here for 2 minutes. The idea is now my arms are up on either side of my spine, as high up towards my shoulder blades as I can, letting my elbows droop forward and keeping my chest pulled up. So we're going to hold this here for 2 minutes, and we're going to work shoulder internal rotation, pails and rails. So now my upper arms are internally rotated in this bear position. Relaxing here for a 2-minute stretch. Pails will be driving both arms into our spine. Rails will be pulling both hands away, trying to keep my elbows fixed. So the idea is I'm not moving both my whole arm backwards, trying to get into extension, trying to get into internal rotation. So imagine that I'm trying to touch my elbows to the wall in front of me and pull my hands to the wall behind me. The higher you are up, the more you are across, the harder that's going to be because we're in that adducted position and that more extended position. Just find that challenging position that you feel like you can be successful today. We got another 45 seconds here. You'll find this is as much of a pillar workout as anything, holding yourself upright into this position without support. If we can master control in these supported positions, both feet, both glutes, while holding my torso upright, it's going to have a better chance of applying to things like we're doing in terms of squatting or hinging. So fight that good fight, hold these positions, develop that strength, develop that fortitude, so to speak, so when you get to these positions where you're really challenged and you're trying to create tension, focus on what this is going to apply to the bigger picture. 10 seconds, quick reminder, pails going towards your spine, rails going away towards your spine. Remember, keeping your elbows fixed, just trying to move from your elbow to your hand, forward and back. Let's take a deep breath in, pack the air down, start to drive both hands forward into your spine, 20%, 40%, 60%, 80%. Your safest, greatest effort, and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, and reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, and now reach up a little bit higher, get a little further across. Getting an ab cramp right there. That's pretty sweet. So we're gonna hold here for another minute, and then we're gonna go into lift-offs. So the same direction we just did on rails. So now we're gonna pull both hands behind us, trying to touch the wall behind us with our hands, and then holding our elbows in the same spot. Getting a pretty violent rectus abdominis cramp right now. Super sweet. The joke is no coaches ever want to do stretch because they're afraid to cramp in front of everyone. I find it a badge of honor. I'm willing to go there, and I'm willing to cramp with the rest of the team here. Corbin also doesn't really do well with this position, so I think he usually gives everyone the out to grab the yoga block. Not me. Get tough, guys. All right, let's go some lift-offs here. So remember, bringing our hands to the wall behind us, trying to drive our elbows forward. We're going to go 10 reps with a 5-count hold. Take a deep breath in, lift your hands backwards and hold for 5, 4, 3, 2, 1, and reset. Pack, lift, 5, 4, 3, 2, 2. Pack, lift, 5, 4, 3, 2, 3. Pack, lift, 5, 4, 3, 2, 4. Pack, lift, 5, 4, 3, 2, 5. Pack, lift, 5, 4, 3, 2, 6. Pack, lift, 5, 4, 2, 7. Pack, lift, 5, 4, 3, 2, 8. Pack, lift, 5, 4, 3, 2, 9. Pack, lift, 5, 4, 3, 2, and relax. We're gonna go one more drill here. So we talked about doing these iso movement paths or these transitional paths. So now what we're gonna do is an infinity circle. We're gonna bring both hands up all the way over my head. Just as we started, now we're gonna complete that movement all the way up. So just follow my lead this first rep. Lift your hands away. Extend your elbows with your thumbs pointed down. Rotate the thumbs up. Bring both arms up. Bring both hands in towards that spine, and then reach it down as far back as you can. We'll lift away, extend, bring hands down, rotate, bring it up and across. That will be 1. We're gonna go 4 more reps with a 5 count up, 5 count down. Lift, 5, 4, 3, 2, and 1. Lift, 5, 4, 3, 2, 2. Lift, 5, 4, 3, 2, 1. Lift, 5, 4, 3, 2, 3. Lift, 5, 4, 3, 2, 1. Lift, 5, 4, 3, 2, 4. Lift, 5, 4, 3, 2, 1. Lift, 5, 4, 3, 2, and 5. All right, that is it, guys. Shake it out. We'll move on to some breathing. If you struggle with some of these positions, don't get discouraged. Just keep chipping away at it. If you felt a cramping sensation, that's usually getting stronger in that position. I would also say too, there's probably a component of hydration and maybe taking a little bit more opportunity to get some water in there, slap some electrolytes in there, get some aminos. Definitely something to help with the process. And if anything, just make sure you pause if you're really struggling or, hey, I'm losing focus or I'm not really keeping these positions. Just try to get the most out of this and treat it like I'm coaching you directly one-on-one. And let's see if we can chip away at some flexibility and mobility over time. All right, let's finish off with some breathing. Okay, so let's finish off with some breathing. We're gonna go 3 positions to choose from. And the reason behind each position, it formats a different way for your body in space. So if my body is facing down, if my body's facing up, it's a different gravitational effect on that thorax, right? So if I'm pointing straight up and we have this negative pressure pulling air into our lungs from the diaphragm contracting, it's different when my torso is pointed down or an inverted position. Now we don't have negative pressure, we have the effect of gravity. So in a sense, I have to contract to inhale. We reverse it, we have to contract to exhale when we're inverted. And that goes into why we want to focus on inhale versus exhale, right? So in regards to the positions, if you really struggled with internal rotation, this one, if I was cramping a lot, I felt like I had nothing, you want to be inverted. And what that does is gets a little bit more of a bias towards exhalation or that breathing out. And the position we want to do with that is going to be an inverted position. We want hips stacked over knees, just like we did in the CARS multi-segmental spine. So hips stacked over knees, elbows on the ground. Now, the more I'm elevated in my knees, the more inverted I am. So we can grab a yoga block, we can place that underneath our knees just like such, and we can get more inverted. We can use books, we can use towels, if you have balance pads, do that. But the more inverted you are, the more effect you have on challenging exhalation. So if you really struggled with that internal rotation of the hip, you want to focus on a exhale bias strategy, AKA inversion. The second position, well, and I know this probably feels a little counterintuitive, but stick with me, is if you struggle with the external rotation with the legs in front, will be that crocodile position, just like we did in our prone shoulder external rotation. So I'm here. And what this is, instead, I know it feels like we're inverted still, but what this is instead is now I give myself some sort of resistance when I inhale. So exhalation for internal rotation, inhalation for external rotation limitation. So now I'm going to bias inhalation or breathing in because I'm giving myself resistance. So as I breathe in through the nose, I'm going to have to push my body away and I have to contract. I have to contract that diaphragm and I have to really pull that air in because I have some body weight resistance as I'm pushing it in. So crocodile if you struggle with external rotation. Now the final one would be a 90-90 with a internal rotation on the left side bias, and I'll show you what that looks like in a second. Where you want to focus on that, if you didn't really struggle with internal external rotation, but you might have felt the left side was a lot more restricted than the right side, specifically internal rotation wise, that's when you want to go a 90-90 internal rotation left side bias position. So what that will look like is I'm going to get a chair or a wall and set up with a 90-90 breathing position. I know that probably seems confusing because we did 90-90 for our position to stretch, but the truth is it's the same 90-90 degree, 90 degree, 90 degree, just kind of a different angle, I guess. So from here, my heels are resting on a chair. I am now relaxed in this position. I want to pull my knees there. If you have a towel or yoga block, we're going to squeeze that between our knees. Remember we talked about adduction? So same thing, adduction now. And then I'm going to try to pull my left heel out and then point my right knee straight back. From here, I'm going to pull my heels down onto the chair or the wall. And what that's going to do is activate my hamstrings and then get my pelvis from this anterior to more posterior position. And what that will do is bias that internal rotation on the left side, and it's going to challenge the diaphragm to breathe against that, like what we call left AIC position. Now, torso matters quite a bit here. Remember, the lungs are different sizes from left to right. The heart's on the left side, the liver's on the right side. So what I'll do is as I'm driving my left heel out, squeezing this yoga block between my knees, I'm going to take my left hand, place it on my ribs, and take my right hand, place it overhead. If you feel more comfortable just going inverted or crocodile, completely fine. But if you felt like, hey, I had a massive limitation on that left side during that hip internal rotation, that 90-90 position with the leg back, I really strongly suggest you go to that 90-90 position. Now, what we're going to do from here is pause, maybe play around with each one of those positions, and then figure out which one you're going to go from there. So if you need to stop right now, please do. Now we're going to go into the actual breathing cadence. So whatever position you are, we're going to go inverted, crocodile, or 90-90. We're going to go into this 4-4-4-8 or 4-4-8 tempo. So breathe in for 4, we'll hold for 4, we'll breathe out for 8, we'll hold out for 8. So I'll say 4-3-2-1, 4-3-2-1, 8-7-6-5, 4-3-2-1, 4-3-2-1, and we'll repeat. So we're going to find that position, and we're going to go through 10 cycles of that 4-4-8-4 tempo. All right, so whatever one you want to get into, let's go ahead and get into that now. So if I'm in a crocodile position, if I'm in an inverted position, or if I'm into this 90-90 position, let's go ahead and do so now. Get a couple breaths in that position just to kind of get comfortable. Remember, we're always going to breathe into the nose. We're going to breathe out through the mouth. No matter what position we're in, whether it's inhale or exhale bias, it's still going to be controlled full air in through the nose, controlled pushing the air out exhalation. The imaginary breathing in through a straw is going to be kind of the metaphor we'll stick with. And we're going to do that for 10 repetitions, and I'll guide you through each one. All right, so let's get that position. We're now getting a couple breaths in. Let's start to get into this direction. So everyone breathe out. Now we're going to breathe in through the nose for 4, 3, 2, 1. Hold that air in for 4, 3, 2, 1. Push the air out through the mouth for 8, 7, 6, 5, 4, 3, 2, 1. Hold that air out for 4, 3, 2, 1. Repeat. Pull air in. 4, 3, 2, 1. Hold for 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. Hold the air out for 4, 3, 2, 1. And repeat. 4, 3, 2, 1. 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 4, 3, 2, 1. Now continue on for 5 more cycles. Thinking about filling in as much of that air in. Keep breathing. So we should be now moving into that hold, that exhale. If you're getting to that inverted position, exhale will get progressively harder and harder. You'll start to maybe get a little bit of lightheaded. Control that breath. If you need to take a break, take a pause, get out of that position for a second. Do so. Try not to make yourself to the point of passing out. If you're in that crocodile position, you're going to really struggle potentially getting into that inhale or that breathing in. If you're in that 90-90 position, you'll find that left leg's going to want to move out of that position. You'll find you'll start to squirm. You'll start to contort. It'll be harder to pull down on your heels. It'll be harder to squeeze that yoga block towel or book. It'll just be harder, right? So that's the goal, is to try to maintain that tempo. 4, 3, 2, 1. 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 4, 3, 2, 1. It's a great tempo to keep on your own. So if you ever need 5 breaths in a good position, anytime you need to do that, we'll get a huge amount of benefit. Getting 5 cycles of that, 3 cycles of that. All right, so we should just be wrapping up that final inhalation or that final exhalation, and we can slowly move from that position. All right, so that concludes our breathing. Really good strategy to help finish off. If you ever need to do that post-session, great aspect of getting a really good targeted effect. All right, we'll break here, and that concludes Stretch for today.